You are listening to Chats with Chumi, a heartfelt exploration of the challenges and victories found in the intersection of motherhood, faith, and mental health. Today we are talking all things pregnancy. Together we'll navigate this journey courageously, untangling the complex tapestry of nurturing life, drawing strength from our shared faith, and striving for mental well-being. Join us as we foster an empowering space for honesty, growth, and connection, one meaningful conversation at a time. And I have Heather with me today. Hi Heather, how are you?
I'm good. It's lovely to be here.
Thank you for coming through for me.
Pleasure.
I truly appreciate it.
Pleasure.
So before we get started, I just want to know more about yourself.
So I'm a midwife and a clinic sister, and I run a well baby clinic. And a well baby clinic, for those who don't know, is where you bring your baby for weigh-ins and vaccines and just help with generally how to parent, because there's a lot of challenges as
you said
parent.
Weigh baby clinic.
Weigh, okay. Yeah, so we weigh the babies and measure them and see if they're growing nicely. I'm a lactation consultant, which is a fancy way of saying that I can help you with breastfeeding.
Yes.
We tend to imagine that breastfeeding is very natural and that one doesn't need any help with it, but in fact it's a learned skill.
And I do want us to cover that as well.
Yeah, so it's a learned skill, and we kind of living in an age where we don't watch women breastfeed, so we don't learn that skill. So actually a lot of moms need quite a lot of support with breastfeeding. Some babies aren't very good at breastfeeding, and some moms need a little bit of help and a little bit of knowledge in order to breastfeed happily.
I agree.
So that's kind of what I do. That's my day job. And I also run antenatal preparation classes. So for couples who are expecting a baby, just preparing the moms and the dads for the birth and parenting afterwards.
Yeah.
So that's me in a nutshell.
Wow, that's amazing. Do you have any children, Heather?
I do. I've got a 20-year-old son and my daughter's 22.
Oh, lovely. I can't wait to actually hear about your experience, but we're going to get there. I think I want to ask you the first question, which is, can one ever prepare enough for motherhood?
That's an interesting one. I do think it's helpful to know a little bit about what you're going in for. Those of us who are very anxious kind of tend to over-prepare and we try and control things when we feel anxious. And pregnancy, giving birth, and parenting are basically lessons in letting go of control, because there's so much that you're not in control of. So in terms of preparation, I think what's most important, apart from maybe reading a couple of books and having some idea of what to expect, the best preparation that you can have is to have a community to support you. So that sense of we need a village to raise a child.
Yes.
So definitely getting support in place is really, really important. So I would focus on that and finding what supports you have in your area, like having a well baby clinic. I would say for my clients, what I see the most effective in terms of preparing them is to have a group of other parents who are expecting at the same time that you closely connected to for support, and then also having a supportive clinic. So there is nothing that can prepare one for parenting. And every birth is different and every child is different, but there are always curved balls, and we can't control a lot around birth and parenting. And so I think it helps to understand that.
Okay, thank you so much for that. I guess you can only prepare for what you can, and get like help from other people as well.
I mean, I run a
like you said.
Yeah, I run a class. It's a 6-week class. It's 12 hours altogether to prepare couples for the birth and parenting. And I get a lot of feedback from the couple saying how incredibly helpful it was.
Yes.
So the knowledge is important and helpful, so that you have an idea of what birth is going to be like, what it can be like, how the dads can support. I think men are largely uninvited into the birthing and parenting space, and they need much more invitation, and they respond so beautifully when they are invited in. So that's quite a big focus for me. I would say that was a big focus. But so there are books out there, but I do think that a class where you connecting with other couples as well as getting quite a lot of information to help prepare you, I do think both are needed.
Okay. Let me just check my next question. Is there a time frame in terms of like when does one disclose
that you're pregnant?
Yeah, that you're pregnant. I'm asking this because some gynaes or some other people are actually advised not to share early. But I just want to know, is there...
I think that's quite an important question to ask.
To you.
I think the stats are 1 in 3 or 1 in 5 pregnancies end in miscarriage. I think it's closer to 1 in 5. So that means quite a lot of loss.
Yes.
And so the premise is, don't tell people you're pregnant because you might lose the pregnancy. But my feeling would be, if I lost the pregnancy, I would want my close friends to know so that they can support me. Otherwise, you are grieving without any validation and support. So I think we all are different, but I certainly would be someone who would need the support. And I think most people do. So maybe you tell your nearest and dearest. That first trimester, those first 12 weeks, that's most common if you are going to lose a baby. That's when it usually happens.
Yes.
And you're not showing yet, so you can keep it a secret. But I'm not a big fan of keeping secrets because I think that you want people to celebrate with you and get excited with you.
Yes, that makes sense.
And then if there's a loss, then there's a loss for them as well. And it's not just you on your own grieving.
Yes.
To grieve on your own is a really painful experience, much more painful than having support when you're grieving.
Yes. So I have a baby as well. My baby is now 11 months. And when we found out that I was pregnant, I was so excited. I couldn't wait to tell my mom, to share with my sisters. So we just shared with like the close people as well. So, yeah. Can we move on to the myths about pregnancy?
Yes.
I have a few here. So it's the size of the tummy, and the heartburn and hair.
Okay.
Because they say if your baby has lots of hair, that's why you have heartburn.
Or that if you have heartburn, your baby's going to have lots of hair.
Yes, your baby's going to have lots of hair.
So that is a myth. There's no scientific, there's no sort of physiological reason why lots of hair on a baby will give a mom heartburn.
And then there's also certain foods, like if you're eating an orange, and then they say orange give babies jaundice.
Yeah, that's not true either.
Yeah.
So jaundice is caused by a breakdown in red blood cells, and oranges have nothing to do with the breakdown of red blood cells. That's more to do with the blood, with the birth, and if there was a little bit of birth trauma.
So it is caused by the...
So are you saying what's causing jaundice?
Jaundice, yes.
Jaundice is caused by if a baby has some bruising during the birth.
Yes.
Then that's going to cause a breakdown of red blood cells, and a byproduct of that is bilirubin, which is what causes jaundice. And also sometimes there's a blood incompatibility if the baby's blood type and the mom's blood type are different. It's called an ABO blood incompatibility. That can cause an increase in breakdown in red blood cells. It's really only a problem from about day 3 to day 7. It's a very short-term problem. It's very easily managed.
Yes.
But certainly eating oranges won't make any difference. There's so many of these things that we always find the mom to blame. I'm always fascinated by these myths.
Yeah.
So it always ends up being the mother's fault. So if your baby's jaundiced, you did something wrong, which is absolutely untrue. And there's so many other things. If a baby's uncomfortable, everyone wants to know, what did you eat? As if the mother's diet, what she ate, is making her baby uncomfortable.
Yeah.
So I always feel so sad about that, because moms always get blamed for everything.
And jaundice is quite common in newborns, right?
Very common. Most babies will be a little bit jaundiced for the first couple of weeks. It's quite, we call it physiological jaundice. It's quite normal.
How long does it last?
If the jaundice is severe, so yes, mild jaundice, which really we just make sure the babies are fed well, because good feeding flushes out the bilirubin.
Yes.
If it's quite severe, then they need to be treated, and the treatment is to put them under lights. They go under lights, and it's not usually longer than 24 hours.
Yes.
And that solves the problem. So it's a very easily solved problem. And you would know that a baby was jaundiced just by the color of their eyes. The whites of their eyes look very yellow.
I see.
And the whites of their gums look very yellow.
Oh, okay.
So that yellow complexion. And what would be more significant even than the color is the baby's behavior. So jaundiced babies very sleepy and they don't feed well.
Okay.
And usually day 3, your milk's coming in. You remember that. So you got a lot of milk. And so you notice at that day if the baby's not feeding well, because your breasts just get more and more uncomfortable.
Yeah.
So it's quite easy to tell if the baby's not feeding well.
Olu also had jaundice, and it was the mild one, because it was like only 2 days. Right. He went, they did the light thing, and then he was fine. Yeah.
It's very easily treated.
Okay. Thank you for that. And now we are moving on to myths about baby. So, one is feeding baby, feeding baby when fussy.
Yes.
And putting paper on the forehead when baby has like hiccups. And this thing of overdressing babies.
So I didn't actually know about the paper to stop hiccups. Hiccups are completely normal. What we notice is in that last trimester, so from about 28 weeks already, most babies are hiccuping, and most moms, when I ask in a class, they'll all put their hands up. They're very accustomed to the baby's hiccuping, and we get so excited about it because it's like evidence of an actual human inside.
Yes, I know that feeling.
So that little bump on your tummy, that's kind of repetitive. But it fascinates me that we never worry about the baby hiccuping inside, but the minute they're born, we find the hiccuping distressing. And the babies, it doesn't bother them at all.
Yeah.
And they hiccup a lot. It's just an immature diaphragm. So hiccuping happens in the diaphragm. And they hiccup a lot the first 6 weeks.
Yes.
And thereafter they hiccup much less. And I mean, even as adults we hiccup.
Yes, we do.
So hiccuping is not an abnormal thing, but it's not a problem to be solved. If they're hiccuping a lot, sucking does stop the hiccuping for a little while.
Okay.
So either sucking on a finger or on the breast or on a dummy will usually calm down a hiccuping episode if the mom is feeling distressed or you feel like your baby's really not enjoying it.
Oh.
But hiccuping isn't a problem to solve.
It's a totally normal thing.
So you said the paper on the head, so I didn't actually know about that.
Yeah.
And then you said feeding babies that are fussy.
Yes, just like overfeeding, always feeding baby when they're fussy.
So in the beginning, I'd say the first 2 weeks, any kind of rooting around, that's what babies do. They might suck on their hands. Those are feeding cues. And we would feed the baby often, and we feed on demand. And on demand means whenever the baby looks like they might be hungry.
Yes.
And then once they get back to birth weight, and we notice, because we usually weigh them once a week for the first 4 weeks, so that we can really see whether the feeding's going well. And if the baby's gaining generously, then we need to discern that not every problem is solved by feeding. And so a baby who's gaining, so we can get, I wouldn't say lazy, but we just lack imagination.
Yes.
And particularly everyone else in the family can lack imagination, because whenever the baby's a little bit fussy, then we can give the baby to the mom because the mom can feed the baby. But then
that's what happens.
Then every problem becomes the mother's to solve, because she's the only one who can feed the baby. So with my moms, once we establish that a baby's gaining very well, there's also what happens is at about 3 weeks of age, our babies get much more fussy. So it's natural for them to get fussier because they get lots of cramps and winds just because they've got an immature gut and they're drinking a lot of milk. And so quite often they are crampy and windy, and their behavior when they're crampy and windy is exactly the same as if they're hungry, because they can't discern whether discomfort in their tummy is from hunger or whether it's from cramps and winds. So then parents actually are required to do a little bit more thinking. If your baby fed an hour ago and they're a baby who's gaining very well and they're rooting around, they probably just have a crampy tummy because they're digesting all that milk that they drank an hour ago. And then we'll do the settling techniques rather than immediately feeding them. If the settling techniques don't work, then you will always feed a baby. So it's not to say we won't feed the baby sooner than 3 hours or whatever, whatever rhythm you're getting into with your baby. Your average baby feeds about 3 hourly. Some babies who are not gaining as well might need to feed closer to 2 hourly sometimes. And there are some rare babies who only need to feed every 4 hours, but your average baby's feeding roughly 2.5 to 3 hourly. But if they're fussing before that and they're gaining weight well, then I would first try and settle the baby. So that's where dad could take the baby and say, so I always ask the dads, I say to the dads, don't take the baby to the mom. If the baby's fussing, ask the mom, when did we last feed? And if the mom says, oh, we fed an hour and a half ago, then the dad can say, oh, then she's probably not hungry. Why don't I settle her? And then it just doesn't feel like the mom has to solve every problem with feeding.
I love that. How does taking care of yourself during pregnancy looks like?
That's a very good question. So there's a lot of planning in terms of like preparing yourself for what things are going to look like afterwards, in terms of arranging, what is your maternity leave looking like financially, how are you going to manage, because of, some people are running their own businesses, and how are you going to manage that? I have far too many mums who think that they can continue running their business and have a new baby and not take a break, and that is quite unwise, because having a new baby is quite all-consuming. Certainly for the first 3 or 4 months are pretty intense. And I do have moms who dabble in work once their babies are born, but one has to be very careful about that, because you end up burning the candle at both ends. So in terms of during the pregnancy, I'm thinking more about planning and, who is going to take over from you? How are you going to manage if you do have your own business? How is there someone else that I can hand over stuff to? So just delegating and kind of freeing a space up for yourself and understanding that you're going to need that time. And I'd say the dads need to do that as well. I don't think men realize how important their role is in terms of being very present for the first 2 or 3 weeks. So I would definitely ask the dads to take paternity leave, whatever maternity leave they're allowed, and then take some annual leave. It's a really important time for dads to be very present.
I think they also appreciate it, having being able to help.
It means the world, but you have to ask the dad, the partner, so he needs to have a sense of that he's needed. And how he can be useful. And as soon as you give your partner a sense of you really need it here, and it really makes a difference. I just see men stepping up beautifully. The men help enormously with the breastfeeding. My dads are phenomenal with how helpful they are with the breastfeeding, so I bring them in hugely there. And in terms of the birth and the kind of support that they can get during the birth, it's a very magical experience for a man if he is actually really invited into that birthing space.
Nice.
So I think that's kind of preparation. So when we talk about preparation, I would say equally important for the men and the women.
Yes, definitely.
And then obviously you are looking after your physical health, and you've got a lot of challenges with being pregnant. There's so many minor disorders of pregnancy that are not very minor.
So you got to name a few.
Well, there's quite a number. So obviously the nausea and just feeling exceptionally tired. So just managing that, and maybe trying to carve out some time for a nap and just kind of listen to your body. And the nausea can be really tricky to manage. And often you're taking small snacks more often. And just pacing yourself a little, because that becomes quite important. Constipation, hemorrhoids, heartburn.
It's really quite awful, like how one gets sick during that time. And
it varies so much. Some women just bloom in pregnancy and they just feel incredibly healthy. So not everyone's the same. And then some women have a real nightmare in terms of coping with their bodies during pregnancy. Also, your body's changing so much. Your center of gravity is changing. Your ligaments are relaxing, and so you can get quite achy. A lot of my moms have quite a lot of pain in their bodies, and I would get that seen too. We tend to normalize quite a lot of discomfort and pain, and a lot of it can be helped with a physio. So I wouldn't ignore it if your body's in a lot of discomfort.
Yes.
And the reason I say that is then you've still got to go through the birth, and those injuries that your body's picking up can just be worse afterwards, and then you've got a new baby to care for.
Yes.
And you've got a lot of discomfort in your body, and you've got very little time with a new baby to go and have your own body kind of looked after. So and then people tend to focus, when we're talking about preparation, people tend to focus on the stuff that we need, all the equipment and clothing for the baby and the baby's room.
And it's not only that.
I would say that that's a very small part of it.
I think that's a cute part of it.
I think that's what it is that it's a fun part, and it also feels like something that we can do to prepare. And I think it's very helpful in terms of preparing yourself emotionally. As you're getting a baby's room ready, there's that sense of, I'm really having a baby. So I'm not discouraging anyone from preparing all the things that they need. But I would also like to say that you don't have to have the best of the best, and you don't need lots of baby clothes. You do need lots of nappies. But a lot of equipment, we buy a lot of equipment that we don't use. So, and one can always borrow things. There's so many people in your community who will have things to lend you. So don't let that whole preparation be spoiled if you haven't got lots of money. I mean, the things that cost a lot of money that you can't really get away from are things like a safe car seat.
That's important.
Travel systems are interesting. Everyone has a pram. You don't necessarily need a pram. I used to just wear my baby.
Also, some babies don't enjoy being on the pram.
That as well. But also prams can cost a hell of a lot of money. So, if one was short of money, I would make sure that you have a good car seat, so that the baby can be strapped in, because you absolutely don't want babies traveling in cars without safe car seats. And I would say that a pram is a secondary if you've got the money, yes, but to wear your baby is very cheap and inexpensive. So the baby carriers or the baby wraps work really nicely.
I just want us to go back to the myths, because some people who say them so powerful that you would start believing, especially if you were like first-time mom, you really don't know much. I just wonder, where do these things come from?
So they pass down in generations. And I think what's really different about your generation is that we have the internet now.
Yes.
And so we Google stuff, and there's a lot of information that's available to us.
That's true.
And our parents were raised in a generation where they were expected to listen to their elders.
That makes sense.
And now that we have access to all this information, there's a real conflict there, because we're telling our parents that actually it's not true what they're saying. and I think it's important to understand how hard that is for our parents, because they're that sandwich generation where they were very much expected to listen to their elders.
Yes.
And we now, because we know better, it's difficult to just comply with information that doesn't make sense to us. And we have read that there's research based, and there's a good explanation as to why that myth is not, why it is a myth.
Yeah.
And I think that's hard for our parents. And to actually be quite gentle with our parents and saying, you know, you did all the right things according to your best knowledge.
Yes.
There is so much more knowledge out there, and we're learning new things all the time. And please understand that I don't respect you any less, but I do have other information, and I need to make the right decision, what feels right for me.
Yes.
But just to do it in a gentle way, so that we don't alienate our parents.
Yes.
But that we also do kind of adult, you know, we are adults, and we are making the best decision for our babies.
Yeah, do it, but be kind.
Yeah.
I wanted to discuss the importance of prenatal vitamins during pregnancy.
They are important. We often, with that nausea, I mean, a lot of women have nausea and don't eat well, and the prenatal vitamins are going to cover anything that you're not eating well. So if you are not eating well,
yes,
then you are going to be deprived. The baby tends to take what they need from you, and so it's more likely the mom who's going to be depleted. But it can also be the baby if you're quite severely undernourished in some minerals and vitamins. And in fact, we talk about taking folate before you fall pregnant. So there are vitamins, there are minerals and vitamins that we actually need to start taking before we fall pregnant.
Yes.
So, you know, within 6 months, so when you've decided that you want to start a family, it's worth seeing your healthcare provider and just getting started with those. They are the folates, the more important thing that we take before we fall pregnant, if we are planning that far ahead.
Yeah. Okay. What I wanted to talk about the benefits of antenatal classes, whether it's online or face-to-face during pregnancy.
If you can't attend in person, online's better than nothing. But the relationships that you build in person-to-person classes is exponentially deeper and more intimate and more meaningful. I had to do all my classes online during COVID, and actually it fascinated me how some of the classes did connect beautifully afterwards, because we were so desperate for connection over those couple of years. But
lonely time.
There is absolutely no doubt that the connection you make with people in person makes a huge difference.
Yeah.
I'm always amazed. I make chocolate cake at my classes.
Oh.
And it's just amazing what chocolate cake and tea and coffee do for conversation and connection.
They glow.
And you can't have that online.
Yeah. What does support during pregnancy look like, and also what are the expectations from family or from your partner? whatever your support system looks like.
Yeah, so support looks like obviously checking in early and booking in with your closest clinic or your obstetrician, whoever's going to be your primary caregiver, because they do blood tests and they just check that you are well, and they will see you regularly during the pregnancy. So early kind of access to healthcare is really important. And then on the emotional care front, it's just really having a supportive network, whether it's your family, your friends, your partner. I have plenty of moms who are having babies without a partner, and they just need a lot more support from their friends and family.
Yes. What did support look like for you?
For me?
Yes.
Kind of what I'm describing. Family, friends, people to talk to. That's why I think the whole keeping things secret is hard, because there's so much that one processes by talking to people and hearing other people's experiences.
And also we rely a lot on like our gynaes or midwife or whoever that you are seeing during that time. I'm saying this because I met my gynae by chance, actually. So I fell when I was 8 weeks pregnant. Yes, I fell, fractured my ankle. I fractured my ankle and went into hospital, obviously. They did an x-ray and they showed it to me after we were done that I actually had like broken bones on my ankle. So the following day I had to do the operation. Now I'm pregnant. What? So they had to like make it really quick. So they covered the tummy with like some stuff. And I remember the anesthetist, because he was talking me through the process, right? And then he says to me, he shows me this long injection and he says, this is what we're going to put on you when you come to deliver. So, I did not even think about delivery at that time. I was just like, this injection is so long, it was so long, and which was basically the spinal injection. So they gave me that. But however, everything went well. And then I reacted obviously to the spinal injection after I was discharged. And then I had to go back into hospital because it was a lot. I was vomiting. I had a headache, which was very, very sore. And then what else? I think that's just to name a few. So I went back in hospital. The gynae that was on call, that's how I met my gynae. She came through. I was just really happy with how she treated me and everything. And I was just like, okay, I think I want her to be my gynae. So that's how I met her. And she was amazing throughout the pregnancy. She really kept me calm. I looked forward to actually going for checkups. I'd count like, when are we going? When is the next checkup? I really enjoyed her. She was
It makes such a difference if you've got a caregiver who you feel super comfortable with. It's so important to feel that you can really trust that person, because they're responsible for your life and your baby's life.
Yes, that is very true. It's sometimes it's like we're putting our lives on them, like
Absolutely.
What does diet during pregnancy look like?
So you need a healthy diet. What is a healthy diet?
Yes.
You need enough good protein, enough good fat. You need fruit and veg to get your minerals, enough fiber. We don't get enough fiber. And as little kind of processed food as possible. Takeaways with lots of kind of fried foods, not so healthy.
Yeah.
And we try and keep sugar to a minimum as well. We tend to eat too much sugar. And then you need to drink plenty of water. And try and drink water rather than drink fruit juices, which have lots of sugar in them.
Yeah.
So I think if we can err on the side of drinking more water and drinking less juice, that goes a long way to cutting down the sugar in your diet.
Yes.
Yeah.
I know this probably won't make any sense, but how much should one enjoy their cravings? Especially because most of them, it's like the unhealthy stuff.
I know. I had a craving for slap chips when I was pregnant with my son. But I didn't go every day. You know, I would maybe go once a week. So, you know, so you do what you can. You know, it depends what the craving is, because some women have, we call it pica, where you have a craving for something that's quite odd and it's not really a healthy thing. So I think I would speak to my caregiver if I was having some really weird cravings.
Yes.
But, you know, we tend to just want something that's comforting, because if you're feeling very nauseous, and I would just say small snacks more often.
Mm-hmm.
And people drink ginger tea, which is quite refreshing and helps a bit with nausea. So there are all sorts of little remedies. But a craving is a craving. I think what sometimes happens with women is that we kind of let ourselves go and we lose any sense of discipline, because I'm pregnant and I'm going to get fat anyway.
Yes.
So I may as well just go to town, and you will regret that.
Yeah.
So I don't think being pregnant is an excuse for just overindulging.
Mm-hmm.
But look, food is complicated. We have complicated relationships with food.
We do.
Because it's so comforting.
Yes, we do.
So I wouldn't judge anyone, but if you want to know the right answer, it's indulge a little, but not too much.
You know, I was looking forward to that when I was pregnant. But I don't think I really got cravings. What happened with me was, when we go to the shops and then I see something, I'm like, oh, I haven't had this in a while. I buy it. And then the following day, I don't want it. So I was like that. I'd see something. I'm like, oh, I want this. I want this. And then I'd only eat it once. The following day, now I'm good. C-section versus natural birth?
So, you know, one's always going to choose a natural birth, or a vaginal birth, I call it, because natural has all sorts of connotations about, you know, maybe not having any pain relief, or not needing an induction, or any of those things. So I tend to call it a vaginal birth. Vaginal birth avoids any surgical risks. So that would always be your first choice. But there are many reasons why one can't deliver safely vaginally, and so cesarean section is a wonderful option if we're not looking at having a safe vaginal birth.
Yes.
So, you know, the South African context is quite unique. I think we compete closely with Brazil, but apart from Brazil and South Africa, there's no other country in the world that has such a high C-section rate. In the private sector, we have a 76% C-section rate. That's very high.
Yeah.
That's 3/4 of women are delivering by C-section. I don't know the exact stats in the government sector, but I think it's between 30 and 40. It's quite high as well. And there are all sorts of interesting questions about why our C-section rate is so high. In Europe, it is rising, but, you know, they've got across the board about a 20% C-section rate. So I think the important thing to know is that it's ultimately not your decision whether you have a vaginal birth or a cesarean section. And I do think it's worth chatting to your gynae or your healthcare provider and asking what your chances are. You know, do you have risk factors that are going to make it more likely that you'll need a cesarean section?
Yes.
So I think communicating regularly with your gynae. If you're choosing a gynae in the private healthcare sector where you can choose a gynae, and you really would like to have a vaginal birth, then I think it's important, before you commit to that particular caregiver, that you check with them. What is your C-section rate? How many of your moms deliver by C-section?
Okay.
There are gynaes in Cape Town who have a 90% C-section rate. So if that's your gynae, you need to have an expectation. I'm probably going to have a cesarean section.
Yeah.
And there are gynaes that do fairly low C-section rates. So, also, one needs to know that you can shop around. You're paying a lot of money, and it's a service. You need to make sure that you're getting the service that you want.
And what is I do know that in private, they tend to have more C-section compared to natural birth than the government.
Yes, there are a number of reasons for that. Litigation is a big reason. Our gynaes pay a fortune, like more than R1 million a year.
Yeah.
For insurance.
Yeah.
That's hectic.
Yeah.
And so litigation's a big issue. And in terms of the courts, you never get asked why you did a cesarean section,
yes.
but you do get asked why you didn't do a cesarean section.
Okay.
So if there's the least bit doubt or concern, then they're very cautious and they'll do a cesarean section.
I didn't know that.
There's also another driving force I can't help thinking is that in the government sector, you work shifts. You work a certain number of hours and then you go home.
Mm-hmm.
And you hand over to somebody else.
Yes.
In the private sector, there's very much an expectation that this is my gynae and they will deliver my baby. And that puts a lot of pressure on those gynaes because when do they ever have time off? If they have to be available 24/7. And so I think that's got to drive a higher C-section rate. Because cesarean sections you can schedule during work hours. Births you can't schedule. So I would also, when choosing a gynae, I would choose a gynae practice where those gynaes do work in a team. Yes. And I think that we need to be less insistent that my gynae is going to deliver my baby.
Yes.
Because if you are working with a team of 4 gynaes and they all have 3 weekends off a month, and because they're covering for one another, then they're much more likely to let labour progress in a normal way rather than trying to schedule births.
Yeah. Okay, I didn't know that.
Those are just a couple of issues,
Yes.
To be a gynae, it's to be available 24/7. That's quite a responsibility.
No, honestly, it is. And it's impossible as well. So I had a natural birth. Yeah. I went through so much pain. Also, I didn't get any medication.
Did you not want any medication?
I did. This thing of shifts, right?
Yes.
So, also the sister that was treating me earlier had now gone home. Yes. So it was someone else. And she did say that should the pain get intense, we will definitely give you something. So when it actually got intense now, she was gone, right? Her shift had ended. So it was someone else. And I asked for something just for the pain. And she said, no, because the baby's coming very soon. So I guess I was also very close to delivering baby at that time.
Yeah, there's right at the end of your labour, that's sort of 8 to 10 centimetre dilated. So just before the pushing stage.
Yeah, the hardest pain of my life.
It's called transition. And for a lot of women, the labour suddenly becomes incredibly intense. And that's a very common time to suddenly feel like I actually can't do this anymore.
I could not believe the pain. I was happy when baby came out. I was actually very relieved.
Of course.
That he was well and healthy,
But you can use gas and air at that point. When it's too late for an epidural. Because the thing about an epidural is going to take good 15-20 minutes to put up an epidural, even if everything's set up.
Yes.
So if you're almost fully dilated, then you're missing the point, because by the time you are anesthetized, now you're ready to push, and you can't push as effectively if you've got an epidural up.
Yes.
So, but gas and air could have eased your discomfort at that point until you were ready to push.
Then maybe I should have done more research and asked for that, but I didn't know. Thank you so much for coming today. Pleasure. I truly appreciate having you here.
Such a pleasure.
Yeah, and I hope that this information does help a lot of people.
And maybe there'll be more questions.
Yes, definitely. As we conclude today's episodes of Chats with Chumi, we hope you continue carrying these insights into your daily dance of faith, motherhood, and mental health. If you found value in our conversation, please share with others who may benefit. Like our episode and subscribe to continue journeying with us, one heartfelt conversation at a time.